are back with Dr. Glenn Rapsinski to talk about another concern for families this fall, a highly mutated strain of COVID-19. And I keep hearing that, highly mutated. So can you walk us through what we're seeing now with this new variant?
Yeah, so the most recent variant that's become of interest to both the World Health Organization and the CDC is a variant that has about 30 different mutations in the spike protein, or the protein that allows the virus to get into our cells. Those 30 mutations make it pretty different, that spike protein pretty different than the ones we've seen in the past.
And so are we dealing with any new symptoms as a result of it?
So there have been very few cases so far in the United States and really worldwide with this particular variant, and so, but the case reports of those have seemed like the symptoms themselves are pretty similar.
Okay, because I know like with some of the first original strains, there was the classic loss of smell, loss of taste, and that was kind of the dead giveaway that you had COVID without even knowing from a test yet. So are we seeing anything like that with this variant that you're hearing of yet?
No, from what I've heard and what I've read so far, the cases are very similar to what we've had more recently. And so as the variants have kind of moved away from the original strain, a lot of that loss of taste and loss of smell has actually kind of
gone away.
Yeah. So has the hyperinflammatory syndrome that we saw in kids and adults as part of the original COVID strain as well.
And you and I were just talking about this. You know, there are some people who are out there thinking this is going to be a really bad flu season because we'll be dealing with the flu and RSV and COVID. But you're saying this is kind of just where we are and probably what we're going to be dealing with every year now.
Yeah, I think we're all recognizing the fact that really COVID-19 at this point is an endemic virus within our community, which means it's going to be circulating every year. And in the winter, we spend more time in the house, we spend more time around in smaller groups. In enclosed spaces, and so it's a lot easier to transmit these viruses.
So much like we track the flu, and if there's a really bad flu season, that we see a strain that is, you know, highly contagious and can be maybe more deadly. Same thing with COVID. We're going to be seeing things like that. Yeah,
if this variant turns out to be more contagious in any way, then we may see a bigger jump in COVID cases this fall than we did the prior fall. But I do think the vaccines are going to provide a good protection against severe infection.
So with the things that you study too in your position, what are you seeing or hearing about with our immunity? Will we be able to fight something like this off? Will we be dealing with more minor symptoms?
Yeah, so I think what we think is probably likely going to happen, because we've seen so many variants come through, and we've seen that really we haven't seen, since the vaccines came into effect, we really haven't seen those giant jumps in hospitalizations and deaths from COVID-19. And so I really think that's going to probably play out very likely with this new variant. Even with all of these mutations, our body has a bunch of different ways to protect us that don't involve just the antibodies that we get from vaccine.
And do you have any advice for families who are concerned about COVID this year?
Yeah, so I think the things we talked about whenever we were talking about the respiratory viruses in the schools, what would be helpful is, you know, hand washing, trying to stay away from people when they are sick, and really to help the community, the best thing people can do is stay home. Whenever you're sick, do home tests to try to figure out whether or not you have COVID, and then follow the CDC guidelines for how long you're supposed to isolate.
All right, thank you so much. I feel like I need to call you Dr. R. Rapsinski.
Yep.
It's fun to say. Thank you so much for this really important conversation and for keeping us healthy this fall.
Absolutely.
Appreciate it so much. For more back to school information, you can head to our website at kdka.com. Still to come on Talk Pittsburgh, our live wedding painters will share how this adds to your special day and what goes into capturing the perfect moment. That's when we come back.